On a Friday afternoon I was coming home from work and my younger daughter rang me and said, "Mum, Marnie's collapsed." When I arrived at the local hospital they ran out and said she'd had a massive brain hemorrhage. Just a really athletic girl who just played every sport, was a national young rider, an academic, ready to take on the world really. When Marnie came out of hospital, it was really, Marnie needed full-time care and it's ongoing.
In my experience, one of the most difficult things for carers is that they just can't see someone's health information. The information flows from GP to specialist and allied healthcare provider to other clinical people in the care team, and carers often get left out of that really important loop. Now, that's where My Health Record can really help.
Care doesn't happen in isolation. With Marnie, she's a young person with complex care and working with multiple health professionals. It was really important for Marnie to have a My Health Record, but it was really important for me as her carer. It really provides me with a level of security and confidence. Probably reduces that anxiety of, if I wasn't here, someone will know about Marnie's story, that Marnie will be managed appropriately.
My Health Record records all the key information that would need to be made available instantly in many cases to a health professional. The details they need to remember are digitally recorded and easily retrieved. And that's one of the reasons I think the health record is so important to carers. From my own experience, I have a son who has epilepsy. He's had it since he was in his teens, and often when he's had seizures he's also injured himself very seriously in the process. The people treating him want to know a whole lot of things. Not only is he in no position to recall those things, but as a carer I'm also in a state of high anxiety and stress, and I can't remember either.
Think about the person you're caring for. They deserve to have a voice, and the My Health Record does provide that. Over time, we'll be able to see what's occurred with her hospitalisations, what's happened with her blood tests, which are critical parts of actually then determining what the next steps of management and treatment are. As the carer, I'm really the one sort of helping to build that record and make sure that the information is being captured that possibly would never have been captured if Marnie had to rely on being the advocate for herself.
Say if you don't remember, you have that on the screen. Having it written down as opposed to having to repeat it so many times is good as well.